Welcome to Evergreen Family Medicine. Today we are with PA Terry Bancroft from Evergreen. Thanks for your time.
Thank you for having me.
Well, are these the most unique times any of us have seen?
It is.
And you being in medicine right now at Evergreen, this is an interesting time to sit down with the provider and sort of do a check-in. So give me an idea about Evergreen's philosophy as it pertains to the way you are responding to this demand right now for medical services, attention, opinion, and help.
Well, thank you, Brian. Evergreen is a very unique place. I've worked a lot of places in Oregon and other states. And I came to Evergreen about 11 years ago, and I just fell in love with it. And the reason I fell in love with this is the spirit of the company. We are a close-knit group, even though we've grown quite a bit in the last few years. We're very collegiate. All of us have each other's back. And the one thing we look at when we look for a provider is, are they a team member? Egos are not a place at Evergreen. We like people who want to take care of patients. They want to invest in that patient's care, and they want to invest in each other. We're all customers, whether it be the CEO, Dr. Powell, down to someone who may do the laundry or whatever. We're all part of this team. And between each provider, we have that same feeling. We check our egos at the door. We're there just to make sure you're healthy and try and get you as healthy as possible. We really look at our providers as far as burnout. What can we do to facilitate the provider's day so they're not just signing papers and checking marks and stuff, that they can actually engage with the patient and be their health leader. One of the ways we do that is by teaching. We're a very teaching-oriented clinic. We'll have medical students from various colleges come in and be with us from a couple of days to up to a month or two. We're very focused, I am, on physician assistant mentoring, and we have multiple schools that we kind of contract with, and our other mid-level providers, our PAs, our nurse practitioners, and the physicians will mentor these students as they're doing their training. And so when you're at Evergreen, it's highly likely you will see a student who's probably just like one of our patients or our patients' kids, or a local person who's going to school, and here's a place that we mentor. Dr. Powell and I have, a long time ago, said, hey, this is a great mission for us, to bring local kids, have them shadow us, see what the field's like, and then go to school, and in school and after school, come back to us. And that way we keep providers who are here and local bred, born, and want to stay here and serve their community. You won't see that any different right now than with this COVID crisis we have right now. Everyone is just working so hard, from our family practice, who's seeing patients who've come out of the hospital or have gotten over their illness and following up with them, to our urgent care, who is just incredible right now. On normal, our urgent care sees about 115 patients a day. Right now, we're about 250 patients a day. And that's 250 patients that aren't in the emergency room. A high majority of these are COVID patients. Actually, I would say most of them are, because if they're able to be seen for a non-COVID related illness at all possible, we'll move them up to family practice that day and have one of the other providers see them. So our goal is to keep the sick away from the not so sick, and kind of an office quarantine. We've expanded to our parking lot where we can screen people, test people. We're even physicians and mid-level providers are going out into the parking lot and working on people as far as their history and physical and what exams they can do just from the cars. And then we actually expanded our family practice. We closed up our boardroom and our library, and that's actually become another place that we can give people Regeneron IV treatments that they would normally just have to get in the emergency room. So everyone is just stepping up. Family practice is working really hard because some of our physicians are hospitals too. So right now, one of our physicians is in the hospital all day. So I'm seeing a lot of his patients today. It wasn't planned that way. That's not how our schedule was, but that's the spirit that we have, is that we're going to step up and help each other with our practice, and that's going to help our patients.
It's remarkable to get a snapshot of what your life is like right now. What do you tell people who say, what can I do in the community to support you? Or we know the burden you're under, I think. Yeah. And it seems nearly impossible, and the effort that you're putting out is incredible. So what can we do to support you?
That is a great question, and thank you. What you can do is think of us. Think of your caregivers, your first responders. It is a difficult time, not only in practicing medicine, but dealing with the social aspect of medicine, because everyone's so left or right, and vaccinate, unvaccinate, mask or no mask. And we fail to think that we are a community. You know, Douglas County is a community. And you may think that something's not important, but it is important because it's important to your fellow man. Right now, you know, we're having to see patients in mass. If they're really sick and actually COVID positive, they're gowned up. That's a miserable way to practice medicine. It's impersonal. You've all had your babies come in to see their provider, and they're scared and anxious. And then we come in there and we're wearing a mask and a gown, and you know, that's just not the way we want to practice, but we have to, you know. I would say the best thing for people to do is get vaccinated. You know, people are dying from not being vaccinated. The hospital's full right now, and our doctors, we have 2 doctors working at a time in the hospital now, where we usually only have 1. And all the people they're seeing, the majority that are really, really sick, are unvaccinated. So that's just one good way that you can slow down the spread and help the burden that these providers are having right now. Keeping yourself healthy, thinking smart when you're going places. You know, the argument with masks or no masks, you know, I've got patients who have some serious medical problems that, God love them, they're just fighting with. I don't think the mask is that big of a deal for us to deal with, you know, considering what they're having. You know, if you've spent 3 months on chemotherapy, you're going to dialysis 3 times a week. That's a burden. Putting a mask on, I don't think is very much of a burden for us, especially in the healthcare system. I think just the prayers in our community for us, we love hearing about that. You know, Facebook posts and just, you know, I've been in medicine since I was 17 years old, and it's a thankless job. And you don't get into it for the accolades, that's for sure. You do it because that's what you're meant to do, is help people. But boy, it sure feels good when someone says, hey, thank you for your service, you know, and I appreciate that a lot. This is a time in our community, our healthcare community, to be patient. The same problems you're having going to a restaurant and not getting served quick enough because there's not enough staff. There's not enough people to pump your gas. We're having that same problem in our office. Our staff, my staff, can be sick. We're down medical assistants because some of them are out. Some of our physicians have COVID. So it may take a little bit of time for us to get to you, to get to those phone notes, to get you in for an appointment. Rest assured, we are doing everything we can to serve you.